welcome back. It is Jen with Aging Advantage. So today we're going to be talking about part two of our fall prevention series. And today I love this topic because we're going to be starting talking about what I love the most, what we can actually do about it, what we can actually do from a prevention strategy standpoint, from an implementation strategy standpoint, and then also from the standpoint again of like observing like our environment around us and figuring out again like what are risks, what can we control, what can we not control, and again putting those things in place so that we can be safer at home and out there, when we're trying to navigate the world outside of our homes. So super excited. And if you didn't watch the part one yet, go back and watch that one. And I think, again, you'll be really, I was going to say floored, but that's no pun intended. No, I'm just kidding. Anyway, you'll be really shocked, I think, and surprised at like how prevalent falls are. So, again, just kind of to reiterate the why this is just so important. So 1 in 3 adults age 65 and older will fall every single year. And again, there's a lot of consequences that can happen health-wise for someone, short-term and long-term, like when they do, potentially fall and, or they do experience a fall, unfortunately. So that's why we are talking about this topic for you guys. So again, Aging Advantage, we are a nonprofit here in the St. Louis area, and we serve St. Louis and the surrounding area. And we do that through grants and donations. And we try to, educate you all on topics such as like housing insecurity, food insecurities, isolation issues, also helping you all just be healthier and more confident doing your, lives out there. But also I try to educate you all as well on how to just be more like resilient overall, physically, emotionally, mentally. And also like how can you be more self-reliant so that you can live more independently as long as you can, as much as you can. Because I know a lot of you are striving to do that these days, but again, like it can be tricky, it can be hard, especially when, you have all these different health challenges going on and just kind of all these different dynamics that are happening in your world and in the world around you. So that's why, yeah, I'm excited to bring all these topics to you again, so that you can all learn from them, which is absolutely incredible. So anyway, today, like I said, we're going to jump into the second part and we're going to start with, again, the part I love the most, which is strategies for prevention. So sit back, relax, all the things, and get cozy and grab what you're drinking. And let's get started today. Okay. So for this part, again, like I said, we're going to be talking about prevention strategies first. Okay, because fall prevention, I want you to know first and foremost, is not necessarily about wrapping yourself in a bubble or like in bubble wrap for that matter, um, and, giving up the activities that you already enjoy doing, that's not necessarily what, prevention is always per se going to be about. It's about smart, actual targeted strategies that address the real risk factors that are in your life. So, for example, regular exercise for balance and strength is the single most important thing that older adults can do to reduce fall risk. So, programs like Tai Chi, for example, have particularly strong research behind them for fall prevention. And let's kind of dissect why is that. So Tai Chi in general is slow, like deliberate kind of movements that help you build strength, but really importantly as well, guys, it really helps you as to improve your balance as well as kind of coordination and also your body awareness. So sometimes I'm going to call, you might hear me call that in other videos. Sometimes you might hear me use the word kind of like proprioception. But same thing again, kind of like figuring out where your body is, or your body parts are kind of in space, but kind of that body awareness, um, in different kind of ways, right? And those things like directly translate to stability in really like in everyday life. So also yoga, water aerobics, walking programs, and resistance training are also really excellent. Here in St. Louis, there are many community programs. There are senior centers and fitness classes designed specifically for older adults, including evidence-based programs. Like, for example, there's one called like Master of Balance, which is offered through organizations in our regions and focuses specifically on fall prevention and building confidence around movement. Another one, like we talked about this a little bit in the part one. So again, if you haven't watched part one, go back and watch these two. But again, talk about that vision and hearing checks. They're essential because, they're an area, again, where most people fall behind on just regular routine care and routine maintenance, essentially for their bodies, if you will. So if you haven't had your eyes checked recently, that's worth prioritizing. Outdated eyeglass prescriptions, undetected cataracts or glaucoma, specifically, even like macular degeneration and all the things like that have not been treated are really correctable problems, that especially cataracts and glaucoma that, can significantly affect fall risk, as well as, like I said, making sure your eyeglass prescriptions and all the things are, up to date. And the same is true for hearing. So getting a hearing evaluation and addressing hearing loss, whether that's through hearing aids or other interventions, supports both safety and overall quality of life. The next one here is going to be medication review with your healthcare provider. And this is something that I absolutely encourage everyone to bring up in their next appointment with their doctor. Because, especially as we get older, as we know, a lot of you are taking a lot of different medications. You're taking multiple types of medications. So you want to ask your doctor or pharmacist to review your full medication list with fall risk specifically in mind. So, are there any medications known to cause dizziness per se, or maybe even like affect balance? And like we discussed also too, like in the last video, sometimes, guys, I want you to know this too. Sometimes like one prescription by itself, this single prescription, even though you're taking a bunch, right? But like this one prescription by itself might have a very, very like low risk of, causing dizziness or balance issues or things like that. But when some medications are paired with you, or coupled, if we'll call it that, with you taking it and another different kind of medication. So when you're taking the two together can cause sometimes, like, depending on what they are, significant issues in this area and having you feel not stable. And it's interesting because if you separate, if somebody was only on one of those, one or the other of them, somebody might totally be fine. But again, like sometimes there are different combinations of medications that can then cause these side effects where you're not feeling stable and you're having issues ambulating, fancy doctor word for like moving around, walking around and all the things. It makes you feel more unsteady when you're doing those activities. So absolutely, bring up these questions about your medication to your doctor and specific or your pharmacist also, and specifically ask them to review everything kind of with the fall risk in mind, especially, if there's a single medication or any kind of combination of medications you might be on that might put you more at risk. A good question to ask in good questions in general to ask. So this could be a get a pen and write this down moment as well is going to be, again, questions you can ask your providers here. Ask them, number one, like we just discussed, like, are there any medications known to cause dizziness or affect balance? The number two to that then is going to be are there any alternatives to those medications that might be a safer option, right? Number three to that is going to be, are there any, like I said, kind of combinations, right? That we just talked about, like that it can be interacting in a way that can affect your stability. And, this, conversation can be genuinely life-changing for some people. And again, I want you all to remember, like y'all have heard me say in other videos too, and other educational opportunities, we all in the medical profession, we work for you, right? I'm going to repeat that again for the people in the back. We all in the medical profession, we work for you as the patient, right? Not the other way around. So you totally have the right, and you absolutely must and need to ask. You always hear me talk to you guys about you got to ask, you got to advocate for yourselves, right? But you especially have to do it in this category because this literally can be life altering if you don't have these conversations and something is interacting wrong with one another. You fall again, you have long-term consequences in your health overall that possibly can't be reversed. And it's just a detriment to your life and your lifestyle that something that could have been prevented and that you could have potentially controlled. So ask, please. And the last one on here too is also going to be like home safety modifications and assistive devices. So we're going to look at this a little more in detail on the next slide. But the biggest thing here is there are practical and accessible ways to reduce your environmental hazards in your own home. And again, most of the time, like that's the only environment we can control. Like once we leave our doors to our home, and you, as you hear me say, you all go out there in the wild, right? You go out there and you navigate around in your community. We don't always have control, obviously, like over all of those environments, unfortunately, but inside your home, most of the time, at least hopefully, for sure, you do. So what can we do? So we can put up grab bars. Another example would be like better lighting, removing trip hazards or like clutter. We want to get all that gone, especially like on the stairs. There should be nothing on the stairs except you. That's it. Going up and down the stairs and the handrail, and bonus points if you put a handrail on both sides of the stairwell, if you need extra assistance. But that's all that should be on the stairs. So you want to get rid of all the clutter, etc. You also want to be using a cane or a walker when it's going to be appropriate. And those are all like really great tools, again, that's going to protect your independence rather than diminishing it, which is absolutely key and what we're trying to do. So next, we're going to talk about some home modification tips. Now, your home should be a safe haven, meaning like a place where you can move freely and confidently. But for many older adults, their homes actually, or the place where they live, reside, etc., actually contains the most significant fall hazards in their daily environment. So like in their environment that they daily interact with. Because again, maybe obviously you're at your own home every single day, right? So that is 7 out of 7 days. Maybe you only leave your house 3 or 4 days a week. So again, in your home is where we have to make sure we for sure get these things right. And again, good news here is that most of these things can be addressed without major renovation projects or significant expense. So let's walk through some of the most important home modifications. So number one here is going to be installing grab bars in the bathroom. So you can see this picture on the left-hand side here, how there's, kind of some different grab bars going on. Um, those are great because the bathroom is one of the highest risk areas in the home for falls. And why is that? Because wet, slippery surfaces, such as like the floor, combined with the physical demands of getting in and out of the tub or in and out of the shower, on and off the toilet, etc., can really make the bathroom a place where falls happen quite frequently. And grab bars installed by a professional in the right location can provide critical stability and support. And this is not just like a nice to have. For many older adults, grab bars in the bathroom are among the most important safety investments that they can make. And if cost is a concern, there's amazing programs, guys, that are out there in our area that can help provide the grab bars for you, that can also help with installation at low or no cost. And, again, us at Aging Advantage, we can help get you connected to some of these resources, or also you could contact St. Louis Area Agency on Aging, or as you've heard me call it throughout some of these different videos for slang, you've heard me called it like SLAA, like SLAAA, but same thing, St. Louis Area Agency on Aging, kind of a tongue twister, but they can help connect you also, like I said, or us, Aging Advantage, with some of those resources. Another thing that we can do is to improve lighting in the hallway or stairways, because this is also key. Many falls happen in low light conditions. So, for example, like when you're getting up at night to go to the bathroom or something, you're trying to navigate a dimly lit hallway, and you might, like, honestly just misjudge a step in poor light. And ensuring, that your home is well lit, particularly in high traffic areas and stairwells for sure, is a simple fix that can have a significant impact. Night lights in hallways and bathrooms are inexpensive and they can make a real difference. Another cool idea too is to put in like motion sensor lights. That's another excellent option. And they turn on automatically when you enter a room or like a hallway or a space. And so that way, you're never trying to fumble for a switch either in the dark. Like you don't have to worry about turning something on, it just automatically turns on. So another thing, next one we're going to look at too is removing loose rugs or non-slip backing. So, or like using the non-slip backing. So, loose rugs are one of the most common and most preventable causes of home falls. So if a rug slides underfoot or curls under the edges or something, or like I said, or you're standing on it again, maybe in the bathroom and the floor is wet and the, floor is slick anyway. And then your rug isn't, attached down, that rug can like slip underneath your feet and that would be bad. But the other thing too, that people don't realize too, like if the corner, again, if the edges of that rug, if it like bunches up or maybe it like squishes, and there's kind of like waves then that happen, in the rug where the rug isn't like flat, anymore because it kind of like wads up. That can also become like a huge trip hazard. And so the safest approach, honestly, is just to simply remove all rugs. And if you need to have a rug, you need to make sure that it is like secured to the floor. you have to have reliable non-slip backing underneath the rug, between the rug and the floor, so it stays put and the rug stays in place. And you need to check them regularly because the backing is definitely going to wear out over time. And so eventually you're going to need to replace the backing, and put new backing down to make sure it's holding still for you. So just know if it's been a while since you checked the backing, if you have non-slip backing on some of these rugs, you need to get in there and get those checked to make sure that they're still working appropriately. Another thing is going to be, again, to keep the walkways clear and to use handrails. So clear, unobstructed, uncluttered, no dog toys, no kid toys, no, you know, three baskets of laundry that you haven't folded for, 2 months, piles of anything for that matter, but like piles of mail that you haven't put away, whatever it's going to be. Those things need to be, handled and dealt with so that you don't have anything obstructed in your pathway when you're trying to move around your home so you can move around safely and freely. And again, this means kind of being thoughtful about where furniture is placed. So the other thing too is you want to make sure cords and cables are also tucked away and not crossing walking paths. You want to keep frequently used items, within easy reach so you're not climbing or stretching as well. This is also kind of key and an interesting one that I wouldn't have thought about before too, but you want to try to keep things like getting as close to you as you can so that you're not like reaching way away from you and challenging your balance. So and the other thing too, we're gonna talk about stairs. So, and whenever stairs or like steps kind of exist, and again, this could be inside your house or outside your house, etc., make sure you use the handrail. Handrails are essential. You want to use them every single time. Don't try to be like, too proud or fancy or, cool or whatever, and zoom up and down the stairs without them. Just use the handrail just in case. It is better to be safe and slow, I say, than sorry. So next we're going to talk about implementing like fall prevention though. So, we've covered a lot of ground in talking about falls, but we've talked about, understanding fall risk to specific strategies and again, like some of the home modifications. But let's kind of pull all this together really like into action. And again, we're going to talk about the things as much as possible here, that again, that are controllable that you guys can put into place because, information is only as powerful as what you actually choose to do with it, right? So let's talk about the implementation part. Again, these are going to be practical steps of making fall prevention real and an active part of your life. So first thing I'm going to do is to, from an action plan standpoint here, I'm going to encourage you guys to try to get some kind of regular physical activity. And I want you to see if you can kind of tailor that to your individual ability. What does that mean? So this looks different for everyone. First of all, just know that, if you're already fairly active, talk to your doctor about adding maybe some balance specific training to your routine. Like we learned earlier, like Tai Chi, for example, could be a good one, good activity for that. There's other ones obviously too though. But, if you're less active, you want to start gently. And kind of build your way up. So that might look like starting with just a short daily walk. And that can make a huge difference. And by short, I mean, it could literally just be a 10-minute walk. That's it. 5-minute walk, 15-minute walk, 20-minute walk. It doesn't have to be anything like big and grand and, an hour long every single day. You can just start with something, again, maybe a 10-minute walk 3-4 times a week. And then you can kind of build up from there. So the goal here is going to be consistency. And just again, making kind of that like gradual progress and, and not perfection, because we're not going to do it right. We're not going to do it right every single time. But if you can do it more times right than not, bonus points. That's what we're trying to do. But, the thing is too, like if you're uncertain really where to start, maybe because you have physical limitations or, whether it's like pain, a disability, et cetera, whatever, a physical therapist can be an incredible resource here because they can assess your specific situation and they can also create a program that's right for you. And I'm going to say along with physical therapy, like we talked about in the last session as well, sometimes in this genre, occupational therapy can also be incredible to, again, make sure that your body is doing what it needs to be doing in a safe way for you and, navigating your environment also that you are in. And the great part about this is, many insurance plans, including Medicare, cover, physical therapy visits. A lot of times also they'll cover, occupational therapy as well, depending on, kind of your back history and what had you arrive at needing, some of the physical therapy in the first place. So another thing is going to be to schedule routine health assessments with your provider, like we discussed. So again, fall prevention is also going to be a medical conversation. So, not just a home safety conversation. So, at your next medical appointment, bring up fall risk specifically. So, you want to ask about your balance, your medication, again, your vision, and your hearing. So, you want to ask again whether, a formal fall risk assessment might be appropriate because there is such a thing. These conversations don't just happen. Please know that, unless if you all initiate them. Because, again, we all work for you, but you have to open your mouth, you have to advocate for yourself, and you have to ask us. So when you do that, it really can open up a lot of doors to resources and referrals and support tools for you that can make a dramatic difference. Another one's going to be, again, to complete a home safety checklist. So what I want you to do, and, if you want to bring in somebody also too, who's like caregiver, family, friend, etc., whatever, I want you to go through your home with kind of fresh eyes, if you will, or better yet, ask someone again that you trust kind of to go through it with you, but see, are there grab bars where you actually need them? Like, do you need one like on the wall next to the toilet? Do you have one there? No. Okay, well then write that down. Is there adequate lighting? Are pathways clear? Are there rugs that are secured, as we talked about with the non-stick stuff, between the rug and the floor? And this doesn't have to be done all at one time, or, even as a great expense. But, you want to start with the areas of highest risk, like the bathroom, stairways, again, bedroom, and you're just in, I guess you could say kitchen kind of too, but, you're going to work from there. And lastly, on here, we're going to talk about connecting with community fall prevention programs and resources. So again, here in St. Louis, there's a lot of programs specifically designed to help older adults reduce fall risk, including the A Better Balance program that I mentioned earlier. There's a lot of exercise classes, strength training, Tai Chi, etc. at some of the libraries that we have. We have incredible libraries here in our St. Louis and St. Louis surrounding area, as well as different exercise classes like this at senior centers throughout the city and also the county. Again, there's also really incredible home assessment services where they can come in and with you look at everything and see again what kind of resources and help and support that you need. So, and that's where here the St. Louis Area Agency on Aging, or SLAE, again, or us, sometimes an Aging Advantage, we also can get you connected to the resources as well um, for this. And it can be like a wonderful starting point for finding what's available in your area. So, as we close today, I want to thank you genuinely for your attention and your commitment, to trying to figure this out because some of this stuff can be tricky to navigate. It's like, okay, well, we all know, all right, we need to try to reduce our fall risk. Great, great concept. But from a step-by-step practical standpoint, like how do we do that? What does that mean? How do we put this stuff into action? And so that's, what I was really excited to be able, to present to all of you. And so, I think again, the fact that you're here thinking about fall prevention in general tells me something very important about you. You are someone that you caregive for example, you're someone who takes your health seriously and you want to be able to stay active and independent and engaged in life. And that matters. And that intention matters because falls, are not inevitable necessarily. Our risk, like we learned, can be reduced. Environments can be made safer. And our bodies also can be made stronger. And like I said, we can do training, strength training, balance training, all the things to check our medications, hearing, vision, like all the different things, right? But we can kind of get our bodies better to be able to be just kind of stronger in all the ways to be able to really kind of decrease that potential fall risk. And with the right information and the right support, many older adults across our area and also across the country are starting to be able to live even more confidently and more actively on their own terms, which I love, 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 love for you guys. So, if today raised questions for you about your own risk factors and specific resources, again, to St. Louis, and what about next steps, for your situation, etc., please reach out. Again, talk to your doctor, connect with SLAY, connect with us in Aging Advantage, connect with a program in your community, talk to your senior center, talk to the YMCA, wherever you are, talk to your pharmacist, connect with someone that can help, support you. But the thing to remember again is you don't have to do this alone. You have a lot of people here to help you and to help you kind of navigate all these things. And first and foremost, I want you to know also, again, that you don't have to wait for a fall to happen. Again, we're trying to not have the catastrophic event like, the fall happens and like now everyone reactively is scrambling to try to get all these things, in check that we just talked about. We don't have to have the fall to happen to be able to get all of these things recognized and observed and to put all these best practices into place so that we have the best fall, kind of like decreased fall, if you will, risk plan in place and, and executed, because the best fall is one that never happens at all. Did you like that? It rhymed? Yeah. No, I'm just kidding. Anyway, again, the best thing we can do is just to not fall in the first place. And that's what we're trying to do. But again, that starts with kind of the practical conversations like we had today. So again, if this will be helpful for anybody that you know anywhere, please, please, please share this with them. And again, thank you so much for being here. And, if you found this content helpful, definitely, like and follow our Facebook channel and subscribe to our YouTube channel and like that as well. But then you won't miss out on any other content that can be really helpful and life-changing for all of you, like we shared with you today. So again, thank you so much for being here with me, and please take care of yourselves and each other, and I will see you guys next time. Take care.